Hello again, my name is Becky and I'm an athletic trainer at the RWC. Did you know that patellofemoral pain is a common knee condition seen especially in active and younger individuals? Well, if you have chronic knee pain, know that you are not alone. So today I'll be going over some of your possible risk factors, and next week I'll go into some of the rehab and prevention techniques. Patellofemoral pain syndrome, also known as runner's knee, causes pain in front and all around and underneath the kneecap. This is very common in individuals who may sit for long periods of time with their knees bent, or on the other hand, play sports that involve a heavy amount of running or jumping. Additionally, a sudden change in activity, intensity, or duration may spark this type of pain as well. There are many factors that increase your risk of patellofemoral pain. The first risk factor can be overuse or overloading. Like I said earlier, the more you run or jump, the more pressure you are adding to your knee joint. Believe it or not, but for sitting for long periods of time can overload your knee joint because of the prolonged time and pressure that is used in order to keep your knees in a bent position. Another risk factor is maltracking of the patella. Most people think that your patella only moves up and down, but that little bone can actually move side to side and tilt in multiple directions. Unfortunately, if your patella does not stay in the central groove of your femur during movements, it can be pulled to one side more than the other, which causes pain and irritation. Patellar tracking disorders can be a structural problem, but maltracking of the patella can also be caused by muscle weaknesses and deficits as well as flat or high-arched feet. Speaking of muscle weakness and deficits, weaknesses in both the quadricep and surrounding hip muscles can cause bilateral or unilateral patellofemoral pain. Weakness in the quadriceps can cause patellar tracking issues, while weakness in the hip adductors, abductors, and external rotators can cause abnormal alignment from the pelvis that can cause pain to extend into your knee. The last risk factor that I'm going to touch on is your foot posture. If you either have very flat feet or extremely high-arched feet, this can create extra pressure within the knee to compensate for either too much height or lack of an arch. Make sure to wear proper footwear that adjusts the alignment of your foot for whichever type of support that your foot needs. If you have any questions about patellofemoral pain, please comment them below. And don't forget that next week I'll be going over rehab and prevention techniques. Thanks for watching, and go Knights!